Greetings and welcome to the International Pediatrics Simulation Society podcast. This show is for people passionate about pediatric simulation-based education, training, and research. Podcast hosts are members of IPSS, a global community of multidisciplinary healthcare professionals from over 30 countries, all dedicated to improving the care of infants and children worldwide. Each week, one of our sub-hosts, Christine Bailey, Elaine Ng, Aaron Karn-Bennett, and myself, Samreen Vora, will introduce you to a new guest and bring you into a conversation with simulationists and healthcare professionals from across the world. Come along. On this episode, we're chatting with Dr. Devin Singh. Dr. Devin Singh is one of Canada's first physicians to specialize in clinical artificial intelligence. He is an emergency physician at the Hospital of Sick Children, SickKids, and holds a master's in computer science degree from the University of Toronto. He is an assistant professor at the University of Toronto in both the Temerity Faculty of Medicine and the Division of Computer Science, and is an emerging scholar helping to innovate the regulatory, privacy, and ethical landscape for AI in Canada and beyond. He is also the co-founder and CEO of HeroAI, a healthcare technology company dedicated to empowering patients and providers with AI. Hello. Thank you for joining us on our podcast for IPSS. We're really excited to have you here, Devin, and I'm really excited to hear about your keynote. So before we jump in, I know everyone just heard your bio, but is there anything else that is not in your bio that you would like to share about yourself?
Sure. Well, first of all, I want to say thank you so much to IPSS and for everyone who put on that incredible conference out in Munich. I had such a blast, and the community is such a thriving one, and I'm looking forward to seeing how AI can become a bigger part of that group. So thank you for the invite to join the podcast. A bit about myself. So, outside of the bio, I think what you don't get captured is the real mission that I'm on, both professionally and personally. As an emergency doctor in pediatric medicine, sometimes you see some really tough cases. And in a junior part of my career, I had a handful of cases where just the wrong patient ended up waiting too long for a variety of factors. And you end up with these tragic outcomes. And I'll tell you, it just is shattering as a clinician. And it's incredibly frustrating when you look at a case that had a terrible outcome, especially when it's related to children. And you go back and you reflect, I wonder if we did this differently, could the outcome have been better? That really upset me in a few particular cases when thinking about how a prolonged wait time in an emergency department might have contributed to that. And so it's really my mission of thinking through artificial intelligence and trying to drive efficiency and workflow and improve patient safety and access and expand our capacity of health systems through automation and AI. It is really geared towards me trying to address a few of these tragic cases that I had as an early clinician to prevent those from happening again, both at SickKids and at scale. And I'll say, as I've matured on this journey over the past 8 to 10 years or so, I'm realizing increasingly that simulation is going to play such a key role to helping us get responsible AI actually turned on at the bedside, which is why I came to the IPSS conference.
I love it. You hit all the key high notes there. The simulation piece. I appreciate you being vulnerable and kind of sharing, right? The things that we see are really tough, and being able to make positive impact. So as an emergency physician and learning over those 8 to 10 years, I think right at the end where you plugged in simulation, because all those folks here listening to our IPSS audience is all about PED simulation. It's all about making those connections that you just described on how do we do better, and then do that at large scale, right? We want this for all kids. We want better. And simulation can get us there. And so I love that we're going to be talking about that intersection with all of the work you've done, quality and safety, and then specifically AI, because as the title of your talk kind of says, right, the rise of AI in healthcare. literally everywhere I'm turning, I hear about AI and trying to understand what that is and how we can harness its power for good, right? And so I love that you say that that's your mission and you're mission driven. I think that's really important because I've also been to some talks about the ethics of AI and all these other pieces, and hopefully we'll have some more podcasts about that. So it's really important to keep that centered. I love that. Well, thank you for sharing that and thank you for joining us. And I think we can jump in. I was in Munich and it was an incredible conference and I had to leave a little bit early. So I'm sad to admit that I missed your keynote and I imagine there were a lot of others who couldn't make it and that will be really excited to hear potentially some of what they missed. And so we can dive in and start talking about some of your key takeaways from your talk. And I'll let you kind of lead the way and maybe start with your first one and we'll work our way through. So the rise of AI in healthcare and the role of simulation. So yeah, tell me a little bit about what was one of the key takeaways from your talk.
Yeah, we talked about a lot of AI, and I'm just
Yeah.
laughing about that because I'm thinking about what it must have felt like in the audience because I had presented so many different AI use cases we're working
Mm,
on at SickKids, and it must have been like drinking water out of a fire hose because there was so much that was discussed. But I think some of the key takeaways. One was around like building off of that intro that I just discussed about and how in our emergency department at SickKids, we're actually thinking about like leaning into this problem of, the wrong patient being left waiting too long. And can we leverage artificial intelligence to potentially even automate a test order for a patient?
mm,
Immediately after triage. Imagine a patient walking into the emergency department, having their data captured at triage, which is the first sort of point of access for a patient when they enter the ED. And what we end up capturing are things like your vital signs, heart rate, breathing rate, temperature, blood pressure, oxygen saturation. We capture some free text clinical notes about, what are the symptoms that they're having and why have they come to the ED. We've got a whole bunch of demographic details and so on, right? And what we wanted to ask ourselves is, could we use that data to actually predict that a patient might have appendicitis and need an ultrasound? And if the wait time was going to be, 4 hours, 6 hours, maybe even longer on a really busy winter's emergency department day, if we could predict right after the patient arrives, like almost time zero, that they are going to need the ultrasound, could we just order the test and get the testing done while a patient is waiting, right? This is one of sort of the flagship use cases that I've been working on over the last few years. And later in this year, we're actually going to turn these models on. And we've discovered that, yes, we can make these predictions really well. They work incredibly well with high precision, low false positives, and would actually enable us for kids like who come in with tummy pain, with appendicitis, to have that abdominal ultrasound order placed almost immediately after they arrive, adding efficiency to our hospital by getting testing done during the day, a much better patient experience by getting testing going while they're waiting rather than waiting those 4 to 6 hours, getting to a diagnosis faster, which means you can activate general surgery faster, get people out of the emergency department. All the efficiencies trickle downstream, and then the improved patient safety by getting someone to surgery faster. It's an incredible use case, I think, for AI, especially in an environment that is incredibly resource constrained. But the reason why I lean into then simulation as a vehicle for helping us get the
Well, let me pause you there. I really want to hear about the sim, but I'm curious to hear a little bit more because that's a huge one, right? We think about how much work over the years has gone into creating all these tools, right? These numbers like scores, right? A triage, like how can we predict? Like that's been a big part of medicine, especially in pediatrics, where you really got to identify those sick kids because they will get sicker much really quickly, right? If we miss that right at the beginning. And so I'm curious, as you said, the models are going to be launching. How long have you been working on those models? Like, how long has that taken to kind of get to this point where you're going to say, hey, later this year, we're actually going to launch this?
Yeah, so we've been working on this for 4 to 5 years right now.
Mm,
And it was one of our foundational use cases at SickKids because it challenged so many paradigms, right? Like if you think about it, the first step was how do you even gain access to the data? right? How do you stream data out of an electronic health record system, land it into a space where you can do this computation? So that was a challenge that we had to solve. The second piece was around thinking through like the privacy, the regulations, and the legal use of this data. And that also informed reinventing aspects of our research ethics board or the IRB board to think through how do you give approval to a research project in a way that balances the need for speed around innovation and development in AI with the incredible rigor and thoughtfulness to respect patient confidentiality, privacy, and sort of like just ethical, respectful use of someone's data to build a tool. And then also when you get to the deployment phases, how do you think through approval to turn something like this on? And so this use case was perfect because it challenged around so many of those different domains, but also gave us an opportunity to start to engage in a very multidisciplinary way. And in that team is including the patients and their families, right?
That's key. That's really important. Yeah.
What's fascinating is that you would assume the patient, the child, wants to get their testing done faster and out the door. And definitely the parent wants that. Like no parent wants to just be sitting waiting for 4 or 6 hours and emerge doing nothing. But we have this AI youth advisory group that we take our innovations to, because not only do we want to capture the parents who sit on a lot of our councils and give us advice and perspective, we want to capture the voice of that kid, right? And I'll tell you, the kids, yes, they don't want to sit in the emergency department, but what they absolutely do not want, loud and clear, is unnecessary testing happening to them.
How
Even if
cool
it's
to hear that from the kids, right? We don't want that either, but
we were
it's
just like,
cool
no,
to,
no, no,
yeah.
no, no. Like, you're going to do what? And so it was an amazing conversation because you start to realize that like this isn't about just like the parental aspect, the systems aspect. The patient and especially in pediatrics should have probably one of the loudest voices at this table, and that's what we try to do at SickKids and with Sky, the SickKids AI program. And so that has informed us around ensuring that the way we deploy these models are done in a way where the false positives is incredibly low. That means that for this appendicitis use case, we're not necessarily going to automate testing for all kids, because if we tried to do that, we'd have a ton of false positives. We're going to capture a sliver of them, 20, 40%. It's still going to drive massive improvement. But if we sort of be a little bit more humble in our thinking and our ambition, and we automate for a smaller, more focused group of folks to get that ultrasound, we can then have incredibly low false positives. And that's exactly what the kids are saying that they want. And scientifically and even ethically, the kids are spot on. That's the right way to go about that. Yeah.
That's brilliant. I'm so glad I feel like that's all really important because that's exactly where my mind went was what are it's so exciting and innovative, but there's always this caution, right? And so as you were like, hey, we're going to deploy it this year, my mind went to, okay, well, what are the possible negatives? Like where could it, and it sounds like you've already thought about those and addressed those and did it in a way where you centered that pediatric patient. How incredible is that to just know that that's how it was done and that the kids, gosh, they know better than us sometimes, which is kind of cool. So I love it. So the next place you were going to go was to then start talking about, okay, well, how does this tie into simulation?
Yeah, well, I mean, that's one of our flagship use cases. But, in the talk as well, we talked about using Gen AI chatbots that are automatically and independently, maybe autonomously even, interacting with patients to provide health literacy information in the near future, to provide guidance. We talked about a Gen AI type tool being a co-pilot in a resuscitation. I actually showed a video of me doing a simulation resuscitation where a live chatbot, live as we're talking right now, was part of our team giving advice around defibrillating a patient who was in a cardiac arrest, or one example of a patient who was in SVT needing synchronized cardioversion. And the bot is giving me live the right dosing, the right timing, the right advice. And so we showed that all in the keynote, and it was meant to sort of spark this creative thinking around hey, we have a really capable technology that of course needs all of the guardrails, all of the ethics, the safety, the legal, the regulatory. And I do a lot of space work in the regulatory space. But where I think that there is a huge opportunity that is going to be essential to all of this is using simulation as a means of testing these solutions, stress testing the workflows, and finding opportunities to improve and iteratively build in simulation into the design process before turning these things on in the bedside. And I think what it's going to do, it's going to help us flush out with much more like authenticity to what the real world workflow is going to be of how these AI solutions actually behave in a workflow, right? So whether that's an automated test order and simulating what that process is going to be in the interaction between a model and a patient, and then like sort of extracting what are some of the latent safety issues that sit in that type of workflow versus a co-pilot that's helping with the resuscitation, and simulation is actually the vehicle for building the tool, right? Before you turn it into real patients, right? There's just this incredibly dynamic role that I think we're going to see explode in simulation as a vehicle for enabling the translation of these tools into real world clinical workflows. And I think it's such an exciting time to be in the simulation space.
Yeah, and the way you've kind of even laid those two out makes sense to me because I think simulation over the last decade, has really evolved to be really strong in those spaces. So, right, the first one where you talked about, hey, let's test workflows. We've done that, right? We have systems integration sims across these quality spaces where, we've done full scale simulations of, say, a rare OR procedure or of new builds, right? And so we have a lot of experience in terms of how do you simulate these workflows to get the most out of those simulations to save money, prevent, future mistakes, things like that. And so it's really cool to build on that foundation that's been built in the simulation world to say, okay, well, we have this new technology. We've already got this foundation in simulation to use as this playground, right, to be able to do that. So that was the first piece I heard you talk about. But then the second, well, two pieces, I think, sim as a way to build the actual tools. And then I think there's a third, right? Simulation to teach people how to effectively and efficiently use the tools as well, right? So I feel like those three, we've got a great playground in simulation to be able to do that. I'm curious to talk a little bit about all of those. Particularly, I was curious about using sim to build the tools. I know we've got some projects that I've been peripherally a part of to use simulation, for example, to use debriefings to train models, debriefings from simulation to train models. I'm hearing you say there might be times where people participating in the actual simulation might be pieces of that you're using to train your models. Can you say a little bit more about that?
Yeah, like imagine you want to build a sort of co-pilot or a resuscitation co-pilot that's going to help you catch when in a real world resuscitation or trauma that you forgot the glucose, or no one's done a temp check yet, or everyone's underappreciated that maybe the hemoglobin is low or something like that, right? Like think of in the chaos of like a major resuscitation, these little common things that can sometimes happen, right? And when you've got that brilliant senior nurse and you get this nudge on your shoulder and says, Devin, I think we need it. We need to get a glucose here, or I think we needed this, right? It's so helpful for you. And I got to say, I'm pretty spoiled working in the emerge at SickKids. Our nurses are just absolutely brilliant, and so I often get taken care of really well on that front, and our patients get incredible care. But you could see at scale there being an opportunity to have an AI solution help guide you through what is often a structured process as well. We're often in a resuscitation following you activate into a pathway, and then it's about following that pathway effectively. If we were to build that, what would the journey look like? And to me, the journey looks like run a bunch of simulations and use that as your training data, whether it's beeline camera data or video data, if it's audio recordings of the resuscitation, if it's the fake sort of demo like Epic ordering or EHR ordering of information, regardless of which EHR you're on. Those are data points that can be generated in a sim environment that is like actively helping the sim team execute their mandate, which is training our staff. But this secondary sort of outcome of capturing the data that might then subsequently help to inform training a machine learning algorithm. right? Or a large language model or a vision tool. And I think it makes total sense that then those types of solutions would be born natively out of simulation data, stress test by simulation, and then applied over into the real world in a very thoughtful, safe, sort of rigorous way. It's a perfect use case. Something that you'd mentioned as well that I think is going to be really important is around simulation also helping to uncover areas that don't yet exist. And so let me describe an example. In this like AI co-pilot resuscitation tool, what does it mean to facilitate closed loop communication between human and AI?
Mm-hmm.
Right?
Yeah.
Like, there's a whole field there that
Yeah.
I think will have to be flushed out, right? And you could think of it simply as AI-based alerting, right? And the human-computer interactions and the subsequent like safety events or improvement of safety issues that occurs by an AI-based alert, right up to like a high-fidelity AI tool is like interrupting you and talking to you just like a human would in a resuscitation. And in the demo video that I showed, this large language model is quite literally just talking at us like a member of the team.
Yeah.
It even gave feedback to me to say that next time I should consider moving to synchronized cardioversion faster because the
Wow.
blood pressure did dip lower and we probably should have escalated our care faster. Like, it was insane. It blew my mind. So like, what does it mean to actually integrate technology like that as part of the team? Right. I think simulation has figured this out foundationally, and this is the space where those discoveries should be born out of, in my opinion.
Yeah, I agree. I mean, I think sim is that space that can um, really further these discoveries pretty quickly. I love that that last example you gave where it tells you next time. It almost reminds me of going way back, right? I think Atul Gawande talking about coaches, right? He was talking in the OR. I don't know if you've read any of his books. It was a long time ago. It was in the beginning of my like medical education journey. I had read some of his books, and he talked about, hey, we don't see each other practice, and we need folks to be coaching us. And so this is coming full circle to that, right? Your AI telling you, hey, this could be a great way next time for you to do better. And I think if we could really, and we can harness sim to then get our healthcare professionals to build all of those muscles so that next time on a patient, you are doing it sooner and maybe saving more lives, right?
Yeah, absolutely. And, and I say this not coming with the bias as being like a simulation expert. Like, I'm not a simulation expert at all. I'm blessed to have an incredible simulation program here at SickKids. Folks like Lennox and Jabin and Mireille doing incredible work in the simulation space as some of my physician colleagues. But I really am approaching this space as the AI innovator and the clinician and someone who's really obsessed with trying to bring these things to the bedside responsibly, that simulation has a really important role here. And I think there's a whole field that's going to emerge out of simulation
Yeah.
very quickly.
Yeah, and I think that's the cool part is the collaboration with someone who's got this expertise like you do in AI, and then those who have these established expertise in simulation, and then to come together to do something, as you said, responsibly. And I think as much as, simulations will be like, yes, we can use simulation for everything. We know that we can't, and we want to be very responsible. We want to make sure we're adhering to even our sim principles. And as you think about bringing AI another place, I love that you brought up closed loop communication is one that we're always talking about. Especially in every sim, every debrief, right? That's coming up. Another piece that comes up for me, we're very particular about being really responsible with simulation. And a big piece in simulation is psychological safety. And I'm curious what your thoughts about that are, right? When we create these spaces in simulation, we've got humans interacting. Do you think it'll impact having AI and having this co-pilot, or even incorporating AI into simulations for either testing or teaching? Do you think there'll be an impact on psychological safety, positive or negative, or any at all? What are your thoughts about that?
Yeah, this is really important, and it's not just in the simulation space, but just in general. So there was a tool that I was actually beta testing. That was a Gen AI based tool that would help with sort of like giving meeting insights. So pretty simple, seems pretty benign. Our meetings are transcribed, and then the tool, you can chat with the tool. And what was really interesting in the very, very early days, and don't get me wrong, this is the whole point of a beta test, is like flush out this stuff, right? And this issue has been subsequently very quickly addressed and solved for. But in the early days, this tool, I started to ask it, compare Devin's performance in the meeting compared to one of my female colleagues, and I said her name, and
fascinating.
and the tool started giving this opinion. I was like, oh, this is kind of and then I just pushed it a little bit more, like, be more specific about like who's really performing better as a leader. And the tool started to describe me as being like really positive and team oriented and action oriented, and described my female physician colleague as argumentative, disruptive, and impatient. And I was like, that is not at all what just happened in this meeting. And if anything, I was the one being a little bit more challenging, I thought. I then asked it, who should get the promotion if there's only a promotion for one? And it said my name. And it was just fascinating to see that it's an example of a Gen AI solution that did not have guardrails put onto it, and clearly was allowing its bias to surface from in which how it's been trained. And it just really stresses the point that, like, if we weren't thoughtful about that and just blindly deployed this thing across an organization, what would that do to the psychological safety of everyone who then does meetings at our institution?
Yeah.
Right? So this is like really, really important. And we address these things. And one of the ways that we actually think of this as an organization is we created SickKids AI, which is actually an enterprise-wide AI service offering that transects every pillar of the hospital. And so if you're deploying an AI solution to clinical or into operational, you come through Sky, and it allows us to bring then together into one space not only the clinical experts and the technical experts, but innovation around like how to think through privacy, the regulatory, the medical legal, the safety, the REB and QI, but also risk. And part of risk includes psychological safety to staff, AI literacy, and training. The one other just quick comment on this that I think is an interesting parallel that hits on this for SIM is the beeline cameras. And institutions using beeline cameras to record actual traumas and resuscitations, and the psychological safety there, and how we overcame that, and who pushed that forward. A lot of it is the simulation teams pushing that forward, and sim groups are masters of psychological safety, and so it's why I think that like that we're going to be okay on that front, because one, we need like really rigorous, processes on an institutional perspective to be thoughtful about it. But then you need folks on the ground to help with mitigating that. And I think it's simulation that'll do that. Beeline is like the perfect example. Now I feel totally comfortable, cameras all over the trauma room and recording.
That's true. Yeah.
I don't even think twice about it, because I know that the way that the information is going to be used is truly to improve the system and not about me. And I've seen that be put into practice, right? And I think if we do similar things with AI, we could help address the concerns around psychological safety.
Yeah, no, all of what you said is so important. And for sure, simulation, psychological safety is such a core part of everything that we do, every sim, every step. And I think that that's really important that we remember that. I think the guardrails piece, I think you also said, thinking about AI and then intersecting all those different spaces you mentioned, right? Having a diversity of experience and backgrounds to be able to give input, to be able to catch those things, like the example you gave around bias. That's where my interest is. I was at IPSS actually, where somebody had presented a program director had used AI to help review applications, because they get so many applications to like weed them out. And so they put them in through one of the Gen AI tools. And one of the pieces that it seemed to work really well, saved him tons of time. But to have the perspective to say, okay, well, where might the bias be? He mentioned that one of the things that did happen is anytime he had an applicant who was Black or African American, versus the other races, it would automatically come back, because one of the criteria when you're reviewing applications is if they've had any felonies. But like only for those applicants would it explicitly say they have had no felonies or
Oh, wow.
convictions of anything, but none of the other applicants. And it was so fascinating, something that unless you deliberately had a lens to be able to make sure you're looking out for that, you wouldn't see it. I would say the same about your example, right? Unless, I mean, you could have completely seen that and been like, yeah, that's totally true. Like I was better in that meeting. But to recognize there's clearly, and there's tons of literature on gender bias, right? And those qualities you just described that the AI said are ones that have been extensively looked at, that women are perceived in this way, even if they have the exact same behaviors. In fact, talking about simulation, it was a simulation study that's looked at. They had people review videos of female leaders and male leaders doing the exact same thing. Because again, simulation is a great playground to be able to really nail down, okay, what are we looking at? And, having those male leaders, even though they're doing the exact same things, exact same phrases, being rated higher as leaders. So I think it's cool for you to say, hey, we have to be on the lookout for that. And psychological safety is important to us as we're deploying these things across our spaces. I think that's really important. So I know we've been chatting for a little while, and I also know we could chat about this probably forever. So I just want to say, we're going to hopefully try to wrap it up, but I'm curious, what other things have we not touched on that came up during your talk, or is there anything else you want to add?
I think the piece that we've danced around a little bit and the talk sort of ended on is really around the importance of these bias assessments and thinking through the subgroup analysis of how models perform. It's not enough to have a global performance metric, but it's also not enough to just like generate these subgroup analyses and just say that you've done it and then deploy. It's like, how do you actually operationalize a lot of these things we talked about, like operationalize privacy and the right rigor in the right way, and risk assessments and bias assessments, and mitigate those things. And so one of the things that our Sky program has done is we've created sort of the playbook of how to think through AI transformation on an enterprise level. We're it's hyper specific to SickKids, and we're generalizing that now and look to push that out just to share the impact there. But effectively, what we're trying to do is create the runway to land these AI projects to the bedside safely and ethically and responsibly. There's so many amazing AI ideas in flight across institutions that we encounter, and especially at these conferences, just brilliant ideas that are floating around. It's how do you create the runway to land them? And without like barriers, knowing that we're at a time as health systems where we really need more capacity, right?
Yeah.
A lot of research coming out saying, adding more humans is a necessary but not a sufficient step to improving healthcare capacity. And so we need these technologies. And, we wrapped up the talk with really just advocating that it's not about just only going faster to get these things to the bedside, but it's putting in the processes, the procedures, having the right playbook so that you go faster, but you simultaneously are improving the rigor in which you assess for safety, bias, equity, and whatnot. And, I'm really proud of it. It took a lot of work for us to start to operationalize this at SickKids through Sky. And we've launched this past year, and we're looking forward to see how we scale the impact widely, both locally here and internationally.
Love it. This is all really brilliant work that you're doing, and hopefully really impactful, long-lasting work, right? And as you launch it there and then across the world, eventually, we'll be here watching. So thank you again for joining us, and till next time.
Thanks for having me. Looking forward to it.
Thank you for listening to this episode of the IPSS Podcast. A special thanks to our behind-the-scenes producer, the talented Denish Kumar, and to the Starship Foundation for providing the equipment that makes this podcast possible. Join us next time.